Good evening, everyone. This is Dr. Famuyiwa, your host of Fertile Talks. So, tonight we're going to do something different. I want to delve into a topic that some of my patients ask me when they get their semen analysis report and they see something that says oligoasthenospermia. And I want to be able to explain what this is. At the end of this talk, I want you to understand what your semen analysis means and be able to understand every parameter in there. And also, maybe we'll talk about some of the things you can do to help your sperm better. It is not an in-depth talk of all the diseases that can affect your sperm. I did record a webinar with my colleague, Dr. David Fennig, on that issue, and he did an excellent job of going into the pathophysiology. I would refer you to go back to my YouTube channel and look up that talk with Dr. David Fennig. So tonight, let's talk about oligoasthenospermia. See, it's even a tongue-tying thing. Oligoasthenospermia comes in various flavors. There's stage 1, which is mild. There's a stage 2, which is moderate, and a stage 3. All right, so we're going to talk about the pathophysiology, the evaluation and treatment, and hopefully you'll glean some things you can do for your lifestyle to help improve your chances. All right, and I alluded to what the different stages, okay? Oligo part of it refers to a low sperm count. Any count that's below 15 million per ml is considered oligo, which is a low sperm count. The asthenospermia part of it refers to the motility. So when more than 60% are not moving forward or in a straight line, that's called asthenospermia. And that is actually a leading cause of male fertility that can significantly impact a couple's chance to conceive. And there can be different etiologies. We'll go into that as we go further along. What is the mild stage 1? Stage 1 has a moderately reduced sperm count, not too bad, but in general, people can still conceive naturally. It may take them a little longer to conceive, but they usually can. The cause of this may be some mild oxidative stress that can cause damage to the sperm structure, and I will go into what oxidative stress is. So the key takeaway for a mild stage 1 is that natural conception is still possible with time and lifestyle changes. Stage 2, you start to see a noticeable decrease in sperm concentration and motility compared to what normal values should be. It reduces the likelihood of a natural conception. And with stage 2, we start to see further damage to the DNA of sperm, causing increased fragmentation. You start to see hormonal disturbances both in FSH and in LH. FSH is needed for sperm development. LH is needed for testosterone production. And usually patients may need some intervention, such as intrauterine insemination, to help them conceive. Stage 3, you start to see more changes, such as a markedly low sperm count. You start to see significant sperm abnormalities, again, probably from severe oxidative stress. And we're going to go into what oxidative stress is. You'll hear me talk about it a lot. You start to see more testicular abnormalities, such as varicocele. Varicocele are dilated veins that can start to affect the sperm production. Spermatogenesis is the name of how sperm develop to maturity. You also start to see some deletions in Y chromosome. It depends on where the deletion is. So for gentlemen who have a deletion, they call the AZF in the C region, may still have some sperm. Now, my colleagues like Dr. Fennick may be able to go into the testes and do some dissection and obtain some sperm. Unfortunately, patients who have deletions in the A or B region usually have no sperm. So with stage 3, they need advanced treatment options such as in vitro fertilization. And with ICSI, ICSI is when it's called intracytoplasmic sperm insemination, is when you take one normal sperm and insert it directly into the egg to achieve fertilization. So now let's talk about what a sperm looks like, right? The typical sperm cells, and again, for our listening audience who might want to go watch the YouTube video of this talk, there's a sperm head that is mostly occupied by the nucleus with the DNA. And then you have what is called the acrosome. It's a sac that contains some chemicals that helps the sperm penetrate an egg membrane. Then you have the neck region that's really filled with mitochondria. Mitochondria, if you will, is the power generating structure in the sperm. It releases a lot of ATPs that you need for the rapid motion for the sperm to move. And then finally, you have a long tail that is useful in propelling the sperm forward. Now, where is sperm made? Sperm is produced in what is called the seminiferous tubules in the sperm. They're coiled, like, think of tiny spaghetti-like tubules, ultra fine, but with a hole in the middle. So the sperm is made from the base of that tubule, and the mature sperm starts to get aggregated and moved into the center. And the whole cell, the cell that regulates this growth, are called the Sertoli cells. I call them the nursemaid of cells. It takes typically about 64 to 72 days for sperm production from start to finish, right? So once the sperm, and this slide here shows you the basement membrane of those tubules. You have the germ cells, the spermatogonia. Those are the immature cells. Those immature cells usually have a full complement of DNA, 46 chromosomes. This has to be split in half so that the mature sperm has only 23. And the reason is a mature egg also has 23 chromosomes. And when you join the mature egg with a mature sperm, the two 23s come together will make a new 46 chromosome entity that we call the zygote, which will become the baby. The Sertoli cell starts to, you see there's one cell that spans the whole lumen of the tubule. So it holds the cells in place, and it guides them as they go through this division process. And the abnormal germ cells present, it kind of eats it up. It also eats up the excess cytoplasm around the head of the sperm, so that by the time you produce the final mature sperm, you only have a very small head with a neck piece and a tail, and all the extra cytoplasm has been removed. Now, what's the role of the Sertoli cells? The Sertoli cells actually provide nutrition and structural support for the developing sperm. They also actually form what's called the blood-brain barrier to prevent abnormal or toxic products in the bloodstream from getting into the tubules where the sperm are made. And it also, as I mentioned, it removes the defective germ cells and removes the extra cytoplasm around the maturing sperm. It also creates an ideal environment for the sperm production process because it also secretes certain fluids and hormonal signals that are important. Now, this is a diagram of what a Sertoli cell looks like. You can see it's a tubule, and you can see the immature cells at the base gradually being guided into mature cells, and you have these long strips over here are mature cells that are moving towards the lumen. Once they hit the lumen of the tubules are all coiled up. So you see this lobe here. They're coiled into lobes, sections of the testes. And they end up depositing everything in the tubule all the way through the neck, which is called the retitestis, into this sac here called the epididymis. The epididymis is a coiled tube where the mature sperm continue to mature and actually gain motility, and it also acts to store the sperm until it's ready for ejaculation. The epididymis also secretes fluids and proteins that help to maintain the sperm survival. Now, once ejaculation is triggered, the epididymis, the sac, the container, the tank, is emptied out through a tubular structure called the vas deferens that goes from the collecting sac here all the way and loops up into the pelvic cavity. This is called the vas deferens. It's a muscular tube that transports the mature sperm from the epididymis to the urethra during ejaculation. Urethra is the hole that you pee out of. It's also where sperm comes out of. And it contracts rhythmically to propel the sperm forward. It also happens to connect with what is called the two seminal vesicles at the base of the bladder. And the combination of the seminal vesicles and the vas deferens will form the ejaculatory duct. The ejaculatory duct mixes sperm with the seminal fluid coming from the vesicle. So let's show you what this looks like. So that long tube we were seeing coming from the vas deferens loops up into the pelvic cavity. You see it here, this long depicted in reddish pink over here. And it ends right about here. And you see these two structures here? Those are called the seminal vesicles, right? And they combine to form the ejaculatory duct down here. This seminal vesicle is responsible for producing 50 to 80% of the semen's fluid, and it contains substances that support sperm survival and the sperm motility. Now let's go a little bit into what the seminal vesicle does. So again, let's go over the anatomy here. The sperm is made in the seminiferous tubules in the testes here. They gather into the epididymis, which is this sac over here. The epididymis stores the sperm until it's ejaculated to the vas, and in this picture the vas is pictured blue, and it loops up all the way into the pelvic cavity, comes behind the bladder, and then it joins these two sac-like structures called the seminal vesicles and becomes the ejaculatory duct over here. Now, another thing the seminal fluid coming from the vesicle does, it produces fructose. Fructose provides energy, sort of like the glucose supplier for sperm, and sperm needs this energy for motility. It also provides prostaglandins that support and promote sperm transport by stimulating uterine contractions. In addition, the seminal vesicle is alkaline, and it helps to neutralize the vaginal acidity so that the sperm is able to survive in the vagina. In addition, the fluid from the seminal vesicle has some clotting factors that help the sperm coagulate right after ejaculation, and that is to protect the sperm, right? It also has muscular tissue that contracts to propel the sperm and fluid into the urethra during ejaculation. Now I'm going to show you what a fully mobile sperm looks like in this slide. Let's see. It's supposed to move, but it's not, so we'll skip it instead. So on to the next, oh, there you go. See, you can see the sperm moving with a purpose. That's what normal sperm should do. They should be able to move straight line. You should see a normal shape of the head and the neck piece and a beating tail. And this is a slide showing normal sperm that are moving actively. Now, if you have, let's look at what the opposite of that would be. So if you look in a slide like I just showed you, you should see a lot of sperm floating around. Abnormal is on this other side here where you see just very sparse amount of sperm, not very many. You should be able to see a normal shaped sperm. Contrast this to abnormal shaped sperm over here where you have two tails in the sperm. This one here has a bent head, and this one over here has two heads. And then also, let's look at motility. If the tail is abnormal or deformed, or the neck piece is deformed, then the sperm cannot move forward. Instead, it might move in a circle or just kind of twitch and shake on one spot or not move at all. So a semen analysis is the cornerstone of diagnosing oligoasthenospermia. And what this test does, it evaluates the sperm concentration, which is the number of sperm present in a given volume of semen. It evaluates the motility, which is the percentage of sperm that can move effectively, and it has to be classified as progressive, moving forward in a straight line, or non-progressive, kind of twitching or moving in a circle, or immotile, not moving at all. Then it also looks at the shape, the structure and of the sperm itself, and we do what is called the strict morphology to assess it. Part of it also involves is the sperm alive or dead. So we look at things like vitality. Other things that you can do besides semen analysis will be measuring hormone profiling, such as your testosterone level, to let you know if your testes are functioning. Testosterone is produced by the Leydig cells in response to LH hormones. You also look at FSH level. FSH controls the proper development of the sperm, like I showed you. So defective FSH levels will mean defective sperm production. If there, sometimes when I refer my patients who have zero sperm to my colleague, they might recommend a scrotal ultrasound to see if there are any structural abnormalities. And we've actually picked up patients who've had testicular cancer just from this. Also for patients who don't have any sperm in their analysis, we would recommend genetic testing to rule out chromosome abnormalities like I've showed you. Now let's look at what a sample semen analysis report will look like. Right, a normal semen analysis has certain things that you see. Number one, it has a volume of more than 1.5 ml. The concentration should be greater than 15 million per ml. And these are WHO criteria, by the way. The total sperm count should exceed 39 million per ejaculate. The motility should be greater than 40%. And out of that, you should at least have 32% moving progressively, meaning moving straight forward. Morphology as defined by the strict criteria should be at least greater than 4%. Now, I told you that the sperm is mixed with seminal fluid from the seminal vesicles, which gives it an alkaline consistency. Alkalinity is measured by your pH. An alkaline pH that you want to see is 7.2 to 8, right? If you have a pH of, say, 4, that's acidic, that's abnormal. That means you're not getting any seminal fluid function in there. You want to see at least 58% normal live sperm, and you don't want to see a lot of white blood cells. If you have a lot of white blood cells, it may mean the men have what is called an orchitis, a testicular infection, and they need treatment. And I digress a little bit here to say some patients may have had TB infection in their testes, for instance. They'll have a ton of white blood cells. Some people have a mumps orchitis. They had mumps when they're a child, and that can totally destroy the sperm. So if the sperm's not moving at all, how do you know? There are certain tests we can do called sperm vitality testing, one of which is called an eosin nigrosin stain. If the sperm has an intact membrane, right, then it should be able to prevent eosin from getting into the cell. If the membrane is damaged, as in a dead sperm, the dead sperm absorbs the eosin dye and appears pink because the membrane is not intact. Another test is called the hypoosmotic swelling test. And this is very simple, just using chemical principles here. If you are in a hypo, meaning a very diluted solution, you put the sperm in there, the sperm is hyper osmotic compared to the solution. So the solution wants to come into the cell. It diffuses into the cell down the concentration gradient. A live sperm that has an intact membrane will simply swell because fluid is coming in. A dead sperm has no intact membrane, has damaged membrane, and has no reaction whatsoever. Another test you can do is called the fluorescent stain, and use a fluorescent dye like Cyber 14 or propylium iodide. And what happens is the dead sperm will fluoresce red and the live sperm will fluoresce green. All right, now let's start looking at some abnormal cells. Here's, gentlemen, where you want to pay attention. So I give you a semen analysis report, and this is what you see. This is a stage 1 mild case. In this case, the volume is normal. The concentration, however, is slightly low. It's 12 million, right? Normal should be greater than 15. The total motility on this case is slightly abnormal. Normal should be greater than 40, and this one has 35%. Progressive motility is slightly low. Normal progressive motility should be 32%, and here you have it as 30%. But again, this report is mild because the morphology is normal. This person has 5% strict morphology. Vitality is fine, 70% of the sperm are alive, and the pH is 7.5, which is within normal range. So we know that the seminal vesicle is working well and producing alkaline fluid. Stage 2. Let's look at stage 2. Again, stage 2, this patient here has a volume of 2, which is normal. However, look at the concentration. The normal concentration should be more than 15 million. You see here the sperm has taken a hit. It's 7 million. It's half what it should be. The total motility is even down further, almost down by half. Normal motility should be more than 40%. Over here, we see a motility of 25%. In addition, the progressive motility is decreased. It's now 20% as opposed to 32%. Now look over here. The morphology starts to take a hit. The morphology is now down at 3%, and the vitality is only half. Only half the sperm are alive, so 50% live versus a normal of 58%. The pH, however, is normal. Remember, pH should be normally between 7.2 and 8, and this gentleman has a pH of 7.4. All right. Now let's take a look at semen analysis that's severe. And I've actually had several patients with this criteria. Especially I had a gentleman who consumed a lot of marijuana. He had no clue. Marijuana is not good for the sperm. There are actually studies now showing that it decreases testicular volume. Gentlemen, it shrinks your testes a little bit. It destroys the sperm concentration and count. Well, this is what happened. This is not this patient. This is a sample. His volume is now borderline. This is 1.5. I've seen patients with volume lower than that. But look over here. The concentration is 2 million per ml. Normal should be greater than 15. The motility is now down to 10% with a progressive motility of only 5%. And the vitality is lower, it's for 40%. The pH is still normal, indicating the seminal vesicle is still working. Now over here, be careful. Sometimes when I see a concentration below 5%, I usually refer these patients to my colleague, Dr. Fennick, and he would also recommend we do genetic testing on these patients to rule out some things like Klinefelter syndrome. Patients with Klinefelters may have very low sperm count or no sperm count. To rule out microdeletion of the Y chromosome that I told you before. Remember, if they have a deletion at the A and B region, they'll probably have 0 sperm. If they have deletion at the C region, they may have some sperm that he would have to go look for. You're not going to find it in an ejaculate. Now, what are the things that could cause this abnormal sperm cells that I told you about? I've alluded to genetic factors such as microdeletion, Klinefelters. Another thing is if you don't have enough hormones coming from your pituitary gland. It's called hypogonadotropic. Gonadotropic meaning coming from the pituitary to the testis. So you don't have enough FSH, you don't have enough LH. Anything that disturbs your hypothalamic pituitary, meaning message from your brain to your pituitary going to the testis, anything that disrupts this can cause this. You could have structural problems like infections I talked about, or mumps or TB or bacterial infection, trauma, or dilation of the vessels, such as varicocele, environmental toxins, radiation, chemotherapy, heavy metals. Where in the world will you get heavy metals? Gentlemen, if you are vaping, you're getting heavy metals and they are dinging your sperm. Exposure to toxins, pesticides in the food you eat, for instance, lifestyle factors, smoking, excessive alcohol consumption. Oh, by the way, there's now a new study that showed that alcohol is linked to at least 7 different cancers. All right, they're trying to petition the FDA to make alcoholic beverages labeled. All right, so alcohol is really not that conducive to your sperm health. Obesity, because it increases heat, body heat, and all the attendant things that goes with obesity, such as type 2 diabetes, metabolic factor, can affect your sperm. Poor diet and stress. We talked about anabolic steroids. Where do you get anabolic steroids? Well, if you are bodybuilding, yay! Okay, so a bodybuilding gives you exogenous testosterone that feedbacks to your brain, and it actually shuts down production of FSH and LH. And guess what happens? That shuts down production of sperm in your testes as a byproduct. Some of these effects can linger for up to a year or two after the medications are stopped. And certainly I talked about opioids, and also marijuana, cannabis can also affect your sperm. I alluded to a little bit about oxidative stress as one of the mechanisms that some of these things destroy your sperm. What is oxidative stress? Oxidative stress is a production of what is called free radical, and that could be as a natural, just think of it as like an exhaust fume coming from your body as it's staying alive, and your body will try to make what is called antioxidant to fix it, to plug the holes. And you can also get oxidative stress from external factors, right? So what are the triggers of internal oxidative stress? If you are doing energy production in the mitochondria. We talked about mitochondria being the powerhouse of the body. Well, as a result of the energy being produced from the mitochondria, you get some oxygen radical molecules that are not completely reduced, and they form what is called a free radical. So this process is natural and it's not avoidable, but the body keeps it in check by making what is called antioxidants, right? And the problem is if you're not making enough antioxidants. If you also have immune system that generates free radicals as your body is trying to fight off infection to destroy the abnormal bacteria and viruses, you get free radicals being produced. If it becomes chronic, then you have an overproduction of free radicals that overwhelms your body's ability to remove those antioxidants. And also, as we age, the body's natural antioxidant capabilities, such as your superoxide dismutase, is an enzyme your body produces to combat this oxidative stress. The body's natural process becomes less efficient, and that leads to increased oxidative stress. You could also have genetic or acquired dysfunction in the enzymes that are supposed to manage stress, such as glutathione peroxidase. And again, once you damage the enzymes that are supposed to combat oxidative stress, you're going to have an accumulation of free radicals. What are the environmental causes of oxidative stress? Air pollution, chemicals, heavy metals. We talked about this: lead, mercury, vaping. Those can lead to free radical production that will knock off your cells, and I'll show you how that happens in a second. Overexposure to UV rays from sun, you get free radicals in your skin cells, leading to oxidative stress, and also skin aging can increase cancer risk in your skin. Tobacco smoking. Tobacco has a high concentration of free radicals and other reactive species, and it depletes your body's own antioxidant, causing extensive oxidative damage. Excessive alcohol intake can also lead to the production of reactive oxygen species that can affect while the alcohol is being metabolized in the liver, and that causes liver damage. External factors, poor diet. So dietary factors, physical stressors, chemicals and toxins. Let's look at diet. If you have a low intake of antioxidant-rich foods, that can reduce the body's ability to combat those free radicals. If you eat a lot of processed and fried foods, those contain what is called the pro-oxidants, which increase the free radical levels. High sugar consumption. Um, so if you consume high sugar levels, it leads to what is called advanced glycation and products that can further damage your cells, right? And they make the cells less pliable and also ages your cells faster. Over exercising, there is such a thing as overdoing it. So moderate exercise may boost antioxidant defenses, but prolonged exercise to excessive levels can also increase free radical production. And I'm talking about people doing triathlons, running, 20, 30 miles a week. Injury or trauma, damaging the tissue. When you damage your tissue, your muscles, you generate free radicals. Exposure to chemicals and toxins such as pesticides that are not carefully washed off food. Be careful of where you get your food. Industrial chemicals and some medications may increase oxidative stress. We talked about infection, like bacteria and viruses can also do that. What are the contributing factors to oxidative stress? Chronic psychological stress. What does this do? It increases your cortisol levels. What is cortisol? It's your fight or flight hormone. And if you are constantly in a state of fight or flight, you produce a lot of free radicals that can overwhelm your system. Sleep deprivation. When you are asleep, your body repairs oxidative damage. If you deprive yourself of sleep, you make yourself vulnerable to oxidative stress. Extreme overweight, excessive fat tissue, and visceral fat will generate free radicals and other inflammatory markers that contribute to oxidative stress. Uncontrolled diabetes, right? High glucose levels will produce excessive, what is called reactive oxygen species, basically free radicals, and that helps to aggravate the problem. So AGE stands for advanced glycation end products. They are harmful compounds. They are formed when proteins or fats combine with sugars in your body through a process called glycation, and they cross-link with other protein and make them stiff and less functional. So they tend to be harmful. Um, and they are naturally formed in the body as part of normal metabolism. But when your glucose levels are too high, the sugar molecules that are excessive will tend to bind to proteins or fats in a non-enzymatic fashion. That's how they get there. They're also introduced in the body through certain foods, especially those cooked at very high temperatures. For instance, grilled, roasted, or fried meats, processed foods like chips and cookies, sugary foods and beverages, and they cause damage in your body through inflammation, especially as they bind to certain receptors called RAGE, or receptor for advanced glycation end product. So this binding of this receptor disrupts the cellular function and promotes one, cellular damage, right? They make the cells stiff and less functional. For instance, collagen in your skin and blood vessels become rigid, which leads to wrinkles and vascular stiffness. They contribute to aging and reduced elasticity in your tissue. Chronic diseases such as diabetes, high glucose levels will lead to complications like neuropathy in diabetics, retinopathy when affecting their eyes, and kidney disease. They also lead to heart disease. They damage your blood vessel walls and they promote plaque buildup. They can also cause kidney disease. The kidneys filter waste and are very, very vulnerable to AGE accumulation. You can also get Alzheimer's disease from accumulation of AGEs. Um, Sources of AGEs, we talked about the foods that are high in this. you can help yourself. There's some food I didn't mention. If you eat a lot of sugary snacks and donuts and sodas, you'll get a lot of AGEs in there. Foods that are low in AGEs are vegetables, raw or steamed, whole grains, legumes such as beans that I mentioned about, nuts if you're not allergic, and seeds. So you can reduce AGE formation by managing your blood glucose level, um, eating a well-balanced diet that have a low glycemic index like whole grains and vegetables, choosing healthier cooking methods, so opting for steaming or boiling or baking or slow cooking instead of frying or grilling, and then avoid overcooking or charring your foods. Um, Also, green tea can help because it's an antioxidant as well. Um, I usually tell my patients though, if you're trying to conceive, it may chelate folic acid. There are other teas that can help as well, such as lemon zinger or any of your naturally herbal caffeine-free teas. Um, and also, you want to stay hydrated to reduce your AGE exposure. What is a free radical? Now, I'm not trying to teach you chemistry here, but usually your electrons are in the outer shell, and you have the protons and neutrons in the center of a nucleus. But the electrons, they're paired together. So in this diagram, you see an atom, and you see three pairs of electrons here, but you see one is unpaired, right? So one is missing an electron. That's a free radical. And what happens is this free radical doesn't like being that way. So it's going to try to steal another electron from a neighboring cell. And if that neighboring cell happens to be your protein, your fat cells, your membrane, well, too bad. It's going to steal that electron and make it unstable, right? So how do you get free radicals? Well, this is for again some of our scientific buffs here. If you have something like radiation or stress, that can split that bond between the two electrons, and you get two free radicals being formed that are unbalanced. The free radical doesn't like to be that way. So it's going to attack its neighbor, steal an electron. That neighbor is going to have an electron missing. So it'll attack its neighbor, steal an electron from it. That other neighbor doesn't want an electron missing. It'll keep stealing. And then you have what is called the domino effect, right? And that process is called lipid peroxidation or oxidative stress. And it just domino effects. And each time you steal an electron from a neighbor, you're destabilizing, you're harming the membrane of that neighbor. So before you know it, the damage spreads like rust. You can't keep stealing electrons without paying the piper somewhere along the line. So what you do is you have to provide something that has extra electrons to give away. Ergo, your antioxidants, right? So foods that are rich in antioxidants, they're rich in excess electron. They donate to the unstable free radical and stop it from stealing from its neighbor. So something has to stop that domino effect, and that's what antioxidants do. So what can we do to treat patients who have abnormal semen analysis? Well, there are surgical interventions, there's medical interventions such as assisted reproduction. I mentioned some such as insemination. I mentioned some such as IVF and lifestyle changes. We talked about that a little bit. Let's talk about some surgical intervention. Again, if you want an in-depth analysis of this talk, please refer to my first webinar. This is an overview, right? So the most common one is a varicocele. A varicocele is a dilated vein, all right, around the testes. And I'm going to show you a picture of that in a second. And when you dilate the veins, you are able to transmit, the blood pools in the testes, and you heat the testes up. Heat is the enemy of sperm production. So increased heat damages the sperm. Some patients may have an obstruction, say in their vas deferens, and they may deferens the long tube I talked to you about that goes from the epididymis back to the base of the bladder, joining the seminal vesicle, and that can sometimes be repaired. All right, let's just go a little bit into what a varicocele is. So this is a normal vein. You see, a normal vein, when blood flows up, it has valves. It doesn't pulse like an artery that can pump blood. It just, the blood flows passively because the muscle around it are contracting, moving things up. And then the blood is prevented from coming back down because of valves. Now imagine these valves being dilated, as in this picture over here. Then the blood can simply just flow back down and it pools in those veins. And when these gentlemen are examined, those varicose veins, they feel like worms under the skin. You can feel them rubbering, right? And so again, this is our anatomy here. You have your testes, you have your epididymis, and then you have the looping vas deferens on both sides, looping behind the bladder to join the seminal vesicle. You see the prostate over here, and then they ejaculate into the urethra. So one thing I did not mention, as I showed you the diagram with the bladder initially, is sometimes some patient may have no sperm coming out the urethra because the sperm backs up into the bladder. So for those patients, sometimes if we do a semen analysis and we don't see anything, we'll have them come back and give them a special protocol and then have them pee after they ejaculate, and we check the urine to see if the urine has the sperm in there. That's called retrograde ejaculation. What are the things you can do medically to treat some of these patients? Well, a doctor like Dr. Fennig may offer Clomid to help to boost FSH and LH levels. He may also give HCG injections, which will stimulate FSH and LH production directly from the pituitary gland. Sometimes I recommend antioxidants as well, and I'll recommend things like vitamin E, vitamin B6, vitamin B12, CoQ10. And you can look at my other blogs on male fertility where I give the appropriate dose. You can send me a message if you need it. We talked about lifestyle choices such as exercise, limiting alcohol, getting sleep, protective gear if you're playing contact sports would help. There are certain fruits that are powerhouses for antioxidants. I love these, such as berries, right? Very high in anthocyanins, which are a type of flavonoid that are rich in antioxidants. Citrus fruits like oranges and lemons, rich in vitamin C. Pomegranates are packed with polyphenols um, that can help produce antioxidants. Grapes, especially red and purple varieties of it, they have antioxidants called resveratrol and flavonoids, which help to reduce oxidative stress. Other things I mentioned earlier, you can try to eat a lot more vegetables, like your green leafy vegetables, such as spinach, kale. You can eat cruciferous vegetables like broccoli or cauliflower or Brussels sprouts. They contain vitamin C and what is called sulforaphane, which help to detoxify harmful compounds and to reduce oxidative stress. Carrots and sweet potatoes are rich in beta carotene, which is a precursor for vitamin A, which is essential for immune function. Tomatoes, they contain lycopene, which is a very potent antioxidant known for its protective effects against certain cancers and skin damage. I already mentioned certain things like nuts and seeds, which are good sources of vitamin E and selenium. Um, and almonds and sunflower seeds are very high in vitamin E. Vitamin E helps to protect your cell membranes from oxidative damage. Brazil nuts are very good source of selenium, which is essential for normal thyroid function anyway, and also helps to reduce oxidative stress. And then you have your whole grains like oats, quinoa, brown rice, which contain antioxidants such as selenium and phenolic acids that promote cellular health. All right, so let's go to the next slide. All right, some herbs and spices. I particularly like turmeric. It contains curcumin, which is a very powerful antioxidant and has very high anti-inflammatory properties. Cinnamon has polyphenols that help to regulate your blood glucose and reduce oxidative stress. Matcha which contains some antioxidant properties, green tea. Um, and you see, I skipped that slide. I'm sorry about that. Then you can simply go to my YouTube page and look at all the slides. So anyway, my whole point of this is to give you an idea of when you look at your semen analysis, what do you understand of it? Where are each line that you see, can you interpret it? Where is it coming from? And it gives you power so you can talk to your doctors, ask questions. And when we say you need additional workup, you start to understand why we're doing that. And also, giving you preventive things that you can do to help us. We're in this journey together, right? So thank you for your time and attention. And if you like this educational content, please support us on Buzzsprouts. You can be a subscriber to our channel. Share it with anyone that you think needs to hear this. And send us comments. We'd like to tailor our future production to what you want to hear. Thank you very much. This is Dr. Famuyiwa again.